I recently had an experience with a patient, Neil, a gentleman in his 70s who struggled with a pattern of behavior that seemed to fit well with the diagnosis of intermittent explosive disorder. I referred him to a psychopharmacologist for medication, which he reluctantly agreed might help, given his feeling that his sporadic attacks of rage were overreactions completely beyond his control. A couple of days later, he called to tell me he had just had what promised to be his last attack. He was outraged when, over the phone, the psychopharmacologist told him his fee, exorbitant by the patient's standards, and he blew up in his characteristic way, an explosion exacerbated by what Neil felt was this doctor's condescending attitude. He now pledged to manage his temper on his own, without the benefit of, as he put it, any fucking medication. I said, "But Neil, I thought it was out of your control." To which he replied, "I changed my mind." What a powerful phrase when you think about it. I changed my mind. Think about that. Our language often has more wisdom in it than we notice. Since that time, the episodes have been dramatically reduced to about 20% of their previous frequency, according to the patient's report. Had the fee been lower, and had Neil liked the psychiatrist better, he probably would have ended up with medication that surely would have been credited with any ensuing improvement. As it turned out, the treatment of choice was referral to a psychopharmacologist with an exorbitant fee and a condescending attitude. Should we do a study to see how frequently that works?